This is Dr. Nathan Vela here at the Foot, Ankle, and Leg Specialist in South Florida at the South Florida Institute of Sports Medicine. I'm here today to talk to you about heel pain. There are many associated conditions that can lead to heel pain, but today we're going to focus on one primarily that we see most common in our office called plantar fasciitis. Now, the plantar fascia is a ligament on the bottom of the foot that primarily supports the arch of the foot and extends from the bottom of the heel bone to the ball of the feet, connecting across the ball of the feet as it fans out. Now, the most common area of pain experienced with plantar fasciitis is on the inside aspect of the bottom of the heel. And why is that? Because the tension is at its highest when you consider the arch, and this being a bowstring and this would be the bow, then this would be the most tense area of the arch. And so the ligament is very susceptible to injury because we tend to stand and walk throughout the day, and if you work on your feet, you're even more susceptible to having the condition. It's also a very common sports injury because of the constant impact to the heel and tensioning of the ligament from running and jumping. Typically, people experience heel pain, especially in the morning when you get out of bed and they first step on the ground. Now, most of us have hard floors at home, and so it makes that pressure felt on the bottom of the heel even more so with every step we take. Well, while you sleep and or rest, the ligament tries to heal itself and it swells, and then as you stand up, you stand on this swollen aspect of the heel. If you tend to put on shoes that are more comfortable or soft, it tends to relieve the pressure and relieve some of the pain. As time goes on, the constant standing and walking and or running that one would do on their foot does not allow the ligament to heal completely, and the cycle of inflammation just continues on. Now, in order to treat this condition effectively, it's really twofold. The inflammation has to be treated and brought down, and that can be a combination of icing, oral anti-inflammatories, and at times, sometimes a cortisone injection if too much time has elapsed and the body is having a lot of difficulty trying to heal that ligament. Now, keep in mind, ligaments don't heal very well on their own anyway because there's not great blood supply directly to ligaments as there is in muscle, bone, and tendon. So with that, we get the inflammation down, and then the next step in the process is to relieve the mechanical pressures on the bottom of the heel, and that's pressure directly from the bottom and then tension from the Achilles tendon and the calf muscle. Now, the more tense the calf muscle is and the more pull on the Achilles tendon that attaches to the heel bone, that will also extend to increased tension on the bottom of the heel bone where the plantar fascial ligament attaches. Daily stretching of the calf muscle can help alleviate that tension, and fortunately for females, they get to wear wedge shoes to decrease the tension of the Achilles tendon pull on the heel bone, relieving some of the pressure and decreasing the inflammation of the ligament. For men, you can add a heel lift into a shoe to match that type of correlation with an elevated heel in the shoe. The other thing is going to be reducing pressure on the bottom of the heel, and that's, again, no walking barefoot on hard surfaces, very soft shoes, sometimes orthotics, and depending on the type of the foot, that would depend on whether or not someone can wear an over-the-counter orthotic versus a custom orthotic, but it definitely has to be soft in the heel because any orthotic that's hard is going to defeat the purpose and have too much pressure on the heel. Oral anti-inflammatory schedulely taken every day would definitely help, and then daily icing will decrease inflammation, as I mentioned before. Now, these combination of treatments are very effective, and there are alternative treatments if traditional treatments don't work, such as PRP injections, electroshock wave therapy, and then very rarely, but is available, surgical procedures to alleviate the tension and decrease inflammation if all else fails. Now, if you have this problem, then feel free to contact us or come and see us so that we can evaluate this problem and try to get you back to your normal life with no pain at your heel. Thanks again for listening, and we'll hopefully see you soon.